Here's something I hear in my office all the time. I can't focus. I'm always restless. My mind is racing. Do I have ADHD or anxiety? It's a genuinely great question because from the inside, these two conditions can feel almost identical. I'm Dr. Lisa Galoni at Turning Point Psychiatry. Today, I'm going to walk you through how we differentiate them and why getting this right matters so much for your treatment. Let's start with what they have in common. Both ADHD and anxiety can cause difficulty concentrating, trouble sleeping, restlessness, irritability, and a feeling that your brain just won't cooperate. So, how do we tell them apart? One of the most important questions is, why can't you focus? With ADHD, the mind wanders because it's seeking stimulation. It gets bored, it chases novelty. The attention drifts even when there's nothing specific to worry about. With anxiety, the mind races because it's fixated on a threat, real or imagined. You can't focus on your work because you're busy worrying about what might go wrong, what you might have said wrong, what you need to prepare for. Another key distinction, avoidance. People with ADHD often avoid tasks that feel boring or tedious, not because the tasks feel scary, but because the brain can't generate the motivation to start. People with anxiety often avoid tasks because they're afraid of doing them wrong. Perfectionism, fear of judgment, fear of failure. Now, here's where it gets complicated. ADHD and anxiety frequently occur together. Research suggests that around 50% of adults with ADHD also have an anxiety disorder, and it makes sense if you've spent your whole life struggling to function, forgetting things, falling behind, disappointing people. Anxiety can develop as a secondary response to that. This is why a thorough psychiatric evaluation matters. Not just do you have ADHD or anxiety, but do you have both? In what proportions? And which one is driving the symptoms? Because the treatment is different. ADHD responds to stimulant medications and behavioral strategies. Anxiety responds to CBT, SSRIs, and nervous system regulation. If we treat only one and miss the other, you're only going to get partial relief. If you've been misdiagnosed or if you're questioning your diagnosis, that's worth exploring. A fresh evaluation by a qualified psychiatric provider can make all the difference. At Turning Point Psychiatry, we take the time to really understand your story because the right diagnosis leads to the right treatment, and the right treatment changes lives. Subscribe for more and share this with anyone who's been told they have one when they might actually have both.